Let's do that, and let's say
I'm going to use the buttons. Arrows.
All right, and so we are recording, and it looks like we will be live streaming on Facebook here in just a second.
Excellent. So yeah, for those of you who are already here too, we are actually, this is our first time we've live streamed on Facebook at the same time that we've done the presentation. So, we're trying to get out there in as many ways. It seems like social media is almost like speaking different languages. We're kind of in different tribes when we're in these different things. But one thing that Keystone has always focused a lot of our attention, and even back in my days back at Hewlett Packard, a lot of attention that I focused was on financial education and really making sure that people understood how things work. And I noticed at the time that a lot of other firms and advisors and things they really do that. They said, well, that's when they become a client. Then I'll tell them what they need to do. To me, that never really resonated with me. I always felt like the better educated people are on topics, I think the better decisions that they can make, and that's really a lot of the value I think that we provide. Is we provide a lot of education on these topics to our clients. Because ultimately, as fiduciaries, as financial planners, it's not our job to make people's decisions for them. Ultimately, people get to make their own decisions. Our job is to educate them, though, and help guide them, really. As advisors, Jeremy and I have spent years and years, really talking with clients individually and in group settings. And one thing that we found is that a lot of the same questions come up, and that's why we really brought Dannette in today. And some of you I know have even visited with her individually, is that she's a Medicare specialist. And Medicare is one of those topics that it just seems to be this murky area out there that people know is really, really important. They know they've got some big decisions that they're going to need to make, has huge financial implications for their family. And so it's an area that we definitely wanted to focus on today. So thank you, Dannette. Thanks for being here today. Glad that we get to visit, and also wanted to introduce Jeremy Bush as well. Many of you know Jeremy as well. Both of us are CFPs, that's Certified Financial Planner, and our role really in our clients' lives is being a fiduciary, which means that we have a legal responsibility to give people advice that's in their best interest. And it might seem like, well, duh, that's what a financial advisor is for. But the reality is that most firms are not fiduciaries. Most financial advisors are actually more product salespeople, which doesn't mean that they're bad people. That's not to bash anybody, but it just is a different relationship that people would have with a salesperson than they would with somebody who's being paid to give them advice and actually legally obligated to give them advice that's in their best interest. So that's really what today is about, really talking about Medicare and really about how it applies to you and your family. So with that, I will open it up for Dannette, and Jeremy pipe in as well on the way. We're going to keep this conversational.
Absolutely. And you know what? I just want to tell everybody who's on, if you do have questions, please put them either in that Q&A section that you find at the bottom of your Zoom page. If you click on it, it'll pop up in a window, or you can also throw it in a chat as well. I will be monitoring those and collecting them throughout the presentation today. So Dannette, please take it away.
All right, guys, thank you so much for this opportunity to be here. And I am so excited to share this important information with everyone. I appreciate your time and taking time out of your day to learn about some important things for your future. So as Jeremy and Josh just stated, Medicare is a very, very important aspect of your financial planning. Healthcare expenses can be huge. Insurance is very important. And so we want to try to put ourselves in a good place as we prepare to retire or to go on to Medicare. So Medicare insurance was founded on the principle that everyone deserves and needs straightforward, honest information. And so that's what we do. We provide, as Josh was just stating, the tools, the information, the education. We don't make a decision for you, but we aid you in that decision-making process so that you can feel comfortable and confident in the decisions that you make. So let's move forward and start talking a little bit about Medicare. If you have looked into Medicare at all or heard much about it, you know that there are many moving parts. And within each of those parts, there are different caveats that apply depending on your individual situation. So choosing the right plan can be very challenging, and we are here to help you understand how that goes. So, as we were talking earlier, there are some questions that we get very commonly in regards to Medicare, and these are a few of the most commonly asked questions that we are presented with. The first one is, am I eligible if I have health conditions? This is very much a concern for many people. The answer is yes, you are eligible. That's the short answer. And no need to be concerned when you first enter into Medicare benefits. You have coverage. And the second question is, what does guaranteed issue mean? This basically reflects part of the answer to that first question. Guaranteed issue means that Medicare will not refuse anyone who is entering Medicare for the first time. So your acceptance is guaranteed. There are a few scenarios in which this applies. And at this time, this is a general presentation. And whenever I speak with anyone individually, we can go into more details if more details are needed. But yes, you are accepted into Medicare because your acceptance is guaranteed. The next question is, how much does Medicare cost? There are some basics about Medicare. So basic Medicare or original Medicare, parts A and B, does have some standard cost. Beyond that, it depends on where you live and your age and what you want to add on to that basic original Medicare. I think that this answer will come to you as we go through these slides. If not, please feel free to send a question to Jeremy.
Yeah, that's always my favorite answer to things as a financial planner is, it depends. It depends on a lot of things.
And it truly does. That is definitely the case with Medicare. There are some general guidelines, but there's so much that depends on you and your scenario. So another very common question is, will my doctor accept me when I change to Medicare? And the answer is yes. In most scenarios, it's uncommon to find a doctor or a hospital that does not accept Medicare assignment. However, doctors from time to time will put moratoriums or holds on accepting new patients. That's because they have to keep their business balanced between those who pay with insurance and they receive their full payment and those who pay with Medicare, which is a lesser payment. So your doctor, especially if you are established with a specific doctor, you have a relationship, then that doctor will grandfather you in to his practice when you change to Medicare. So there's very little to be concerned about, very little to be worried about. If you, as you turn 65, you will be accepted. So the next question is, should I go on my employer's retirement plan or on Medicare? So this is one that is definitely requires some sit down time where we would review with you your employer's retirement plan, the cost, the monthly cost, the annual deductibles, the different benefits involved with your employer plan versus the cost and the benefits with Medicare. Because bottom line, what does it all come down to? Really, we all want to get the best coverage at the most effective rate. And so cost is really the biggest consideration, but there are others as well in making that decision. So we're going to compare things for you so that it is understandable and easy for you to see which is the direction for you to go. The next question is, will I be covered during foreign travel? Well, obviously, when you retire, you're going to have more of an opportunity to travel, take trips. And so the short answer on this is yes, there are plans in which Medicare will cover you, not beyond emergency room visits, but when you think about it, that's probably ample when you're traveling overseas, because if you have a slight injury, you need to have a couple of stitches, then you go to an emergency room or an urgent care if they have those in foreign countries. Anyway, an emergency room, and get a few stitches and you're on your way, continuing on with your trip. Something more serious, you would be seen at that emergency room. And then, of course, you would want to come home to be treated by familiar doctors within your area and places that you're familiar with. So really and truly, foreign travel coverage for emergency rooms is generally ample coverage with Medicare.
And that's important too. This last year, obviously, foreign travel hasn't been a thing for most of us anyway. I think Mexico is probably the only country that really is letting Americans in currently. But, it's definitely a concern because a lot of clients, once they hit that point where they're, financially independent or retired, depending on what term you like to use. But a lot of people, that's kind of a big part of their early years of retirement, at least, is they really plan on getting out there and seeing a lot of things in the world. So I've definitely gotten that question from clients, is they're a little bit concerned about, well, what happens if I get sick or hurt or something like that outside the US?
Yes, and absolutely, that's absolutely the scenario with retirement. So, and been put on hold a little bit for the time being, but hopefully that comes back for us all. So, okay, let's go ahead and move forward. And I appreciate your input, Josh. So let's continue on with the basics of Medicare. So Medicare Part A is hospitalization. Medicare Part A does not cost us anything once we start on it, as long as we have contributed to it for at least 40 quarters of our working career. Most likely, we are unaware that we have been contributing to it. That's part of those employer deductions that they take before we actually receive our paycheck. But that has been going into Medicare Part A. Therefore, Medicare Part A does not cost us anything. That is Medicare Part A, which is hospitalization. Then Medicare Part B is everything else medical. So it does come with a monthly premium. That base amount is $148.50. Everyone pays this. Now, there is a small group of people who earn a higher income, and it graduates in tiers in which Social Security will place an income-related surcharge on your Part B premiums. So if you are in that category, good for you that you've worked hard and you're earning a higher income, but it's a little bit of a catch-22 because you have to pay more for your Medicare Part B. That will be assessed through Social Security. And once you start on Medicare Part B and start that $148.50 a month premium, if you're receiving your Social Security benefits by then it will be taken out of your monthly benefits check before it is sent to your bank. If you are not yet collecting Social Security benefits, then Social Security will bill you, but they will bill you on a quarterly basis. So don't be surprised when you receive a bill in the amount of $400 and something, because it is for a 3-month time frame in that case. All right. So when you turn 65, you have a little window to sign up for Medicare. It is 3 months prior to the month of your birth, the month of your birth, and 3 months after the month of your birth. So a 7-month time frame in which you have to sign up for Medicare, and that's when you're turning 65. If you're over 65, and you stayed on employer plans, and we're going to go into a little bit of more detail later on with this, then once you leave your employer coverage, you must sign up for Medicare within 6 months of leaving that employer health coverage. And you must have Medicare Parts A and B, which is considered original Medicare. You must have A and B in place before enrolling any further into Medicare, which could be a Medicare Part C plan, also known as Advantage, or a Medicare supplement, also known as a Medigap plan.
Hey, Dannette, one question that we get a lot from clients on that surcharge is that some people are wondering, so what happens if you have a big year? And sometimes when people retire, for example, our clients, many have some stock options or some kind of a payout that they have that maybe even hits after the year that they retire. So what happens if they find themselves in that group, they find themselves paying that surcharge, but they say, well, that's not fair because that's not my long-term income, that's going to be just the income for this year. What do they do about that?
That's a really, really good question, Josh. The fact is that whenever you start on Medicare Part B, Social Security is going to look back at your tax return from 2 years previously. So for the year of 2021, they will be looking at your 2019 tax returns, and that's how they will decide your present day assessment. So the good news is if you had a really big year, 1 year, then the assessment will take place for next year. You may not be paying so much because they will look at the year 2 years previous. So you may have some years where you have higher assessments. You may have years when you have lower assessments, and eventually it may all even out as your retirement years progress. So that's a very good question. It is assessed every year, but it is based on the 2 years previous tax return.
Yeah, and they make that adjustment automatically then. In other words, people don't have to go back to Medicare and say, hey, my income went down and so forth.
Right,
Look at
right.
that. Yeah.
Right. That's true. And originally, if you receive an assessment and you feel that maybe there is a reason that it was unfairly or inaccurately put upon you, then you can appeal that to Social Security and they will review it. There is a form to fill out and we can supply you with that form. So you can appeal that. And if you are correct, it may be adjusted. If you're not correct, that assessment may stand for the time being.
Yeah, we've had some clients that have reported back that they've been successful at those appeals too. So it's definitely something to look into if you're in that situation.
Absolutely, absolutely. Okay, so let's continue on and talk a little bit more about Medicare Part A. And again, a reminder, this Medicare Part A and B are known as Original Medicare. So Medicare Part A, again, is hospitalization. And again, we are not paying a monthly premium for this, but it does come with a per occurrence deductible. So note that is per occurrence. It is not an annual deductible, which most of us are used to with annual deductibles. This is a per occurrence deductible, and that deductible is $1,484. So if you were hospitalized more than once in 1 year, you're going to be paying that twice. You're just going to be paying it every time that you're hospitalized. And the good news is that after that, Medicare is going to pay for your first 60 days if you remain in the hospital. Most of us are rarely in the hospital that long, so that's good news. We would not be paying daily cost. However, if you stay longer than 60 days, you're going to be liable for $371 a day, and even longer, 91 days and beyond, $742 a day. And these are figures that change occasionally from year to year, and they take effect in January when they do make changes. But this is the current rate 2021 for what you would be paying for Part A hospitalization. Part A hospitalization also includes skilled nursing care. And let's say a scenario, someone has a surgery and they are in the hospital for 5 days total because that required, some ongoing care. Then the doctor sent them over to a skilled nursing facility or rehab unit for 2 weeks follow-up after the release from the hospital after 5 days. So then Medicare is going to pick up those 2 weeks that your doctor told you to stay. If you have to stay longer, more than 20 days, then you are going to have to pay $185.50 yourself. So I gave you the scenario of a 5-day stay in the hospital for a reason. That is because Medicare will pay the skilled nursing benefit only if you remained in the hospital for 3 full days. So that's something important to remember. If you are hospitalized, you need to be there at least 3 full days before Medicare will pay the benefits of a skilled nursing facility or rehab unit after you're released from the hospital. Excuse me. All right, let's talk some more, excuse me, about Medicare Part B. Medicare Part B is everything else that is not hospitalization. So it can include doctor visits, surgeries, same-day surgeries, MRIs, CAT scans, lab work, going to your doctor's office once a month if you have rheumatoid arthritis for those infusions to deal with your pain. So it's everything else except basically daily room and board in the hospital. And a reminder, your Medicare Part B does have a monthly premium of $148.50 a month as a base amount. It has an annual deductible of $203. So this is really an easy peasy deductible. Most of us in the world of health insurance are used to deductibles annually of $2,500, $5,000, sometimes even $10,000.
Yeah.
So an annual deductible of $203 is certainly easy to deal with. So if someone has original Medicare in place, that is Medicare Parts A and B, some sort of health scenario comes along, we can expect that Medicare is going to cover approximately 80% of that situation. And then we would be liable for the remaining 20%. So break that down a little bit more clearly. Let's say something came along, the total bill was $1,000. Medicare is going to pay $800 of that. Our liability would be $200. I can deal with that. It's acceptable. I'm not going to choke on it. But if that bill happens to be $100,000, and we all know that in the world of healthcare, these numbers are possibilities for sure. $100,000, our share would be $20,000, and that's going to be a little more difficult, and that's certainly going to prompt us to look at different options that are within Medicare that we can minimize some of those out-of-pocket expenses that we would be liable for. So talking about having original Medicare A and B in place, we have basically two options of how we want to help ourselves with that possible liability of out-of-pocket costs. The first option is taking our original Medicare, lumping it all together, A and B, and coming up with a Part C plan, also known as Advantage Plan. And technically in the world of Medicare, if you do this, according to Medicare, you are no longer on original Medicare because you've taken your A and B and lumped it all together into a Part C plan. These Part C plans are required to have all the components of A and B, so you don't lose anything, but you're technically just considered no longer on original Medicare if you go this route. The other option is to maintain your original Medicare and add a Medicare supplement, also known as a Medigap plan. And we're going to talk a little bit more about each of these options. So if you choose a Medicare Part C Advantage plan, there are many companies that offer these plans: Humana, United Healthcare, Cigna, Aetna, Bankers Fidelity, Blue Cross Blue Shield. There in Colorado, you also have Kaiser, who offers Part C Advantage plans. So in the case that you choose a Part C Advantage plan, the plan, let's say it's Humana, becomes your primary insurer. Medicare is your secondary in this case. So some more aspects to talk about. Possibilities of a Part C Advantage plan. Most all companies offer plans with low or zero monthly premium. So this is totally a plus. Remember, however, that everyone pays their Part B premium of $148.50. So you're not getting away completely free of monthly premiums, but generally when we have those taken out from Social Security when we're already on benefits, we kind of don't even think about them, but that needs to be kept in the back of your mind. You're going to be paying $148.50 regardless. We can put you on a zero monthly premium Advantage plan, Part C plan. And another aspect of these plans is the fact that they can include prescription drug coverage. So this is great. You don't have to purchase a separate standalone prescription drug plan. We would certainly take into consideration the medications that you take, in choosing, helping you hone in on a plan that's going to work for you. These plans also might add in additional benefits such as some basic dental, some basic vision, health club access. Some of them even have transportation benefits to and from medical appointments. Some of them even have monthly credit card subsidies for over-the-counter pharmaceuticals. So they're competing for your business. These plans always have guaranteed issue. You never have to answer health questions when you join a Part C Advantage plan. So that's another good thing. Sometimes people, I'm just going to throw this in, this is a little aside, will say, gosh, how can they charge a 0 monthly premium and I don't have to answer any health questions? What's the deal? Well, the deal is that Part C Advantage plans receive a monthly subsidy from Medicare for every person who joins these plans. So they're happy to receive you because they're going to be paid to receive you into their plan. All right. Another aspect of these plans is that they are part of a network, either an HMO or a PPO. In the world of healthcare, we're used to dealing with networks. So again, this is kind of no big deal if you're used to it, but take into consideration, like we spoke of earlier, sometimes we want to take trips, we want to travel after we retire. And being part of a network definitely puts a crimp in that. You have to make special arrangements. If you live in Colorado, you want to go visit family or friends in Oklahoma. If you want to leave Colorado for the winter and go stay in Florida for 2 or 3 or 4 months, you're going to have to take some steps and check in with your plan to see what they can offer you. So that makes it a little bit difficult. When you have an HMO, you have to designate a primary care physician. That physician becomes basically the coordinator of your health care, and you have to go through that physician whenever you want to have any healthcare services performed. So you have to check in with your primary care physician if you have a Part C Advantage plan. These Part C Advantage plans are a calendar year plan. So they start in January, go through December. You may stay on that same plan and just renew or just continue on, and it will start again January and go through December. If, however, you want to make changes to that plan, there are only certain times that you can make these changes. Typically, that is in annual enrollment period, which is October 15th through December 7th. These changes that you make during that time frame will go into effect starting January 1st of the following year. Additional aspects of Part C Advantage plans is that you have low or 0 monthly premiums, but you have co-pays for almost all services. So that's something to keep in mind, that co-pays happen with almost everything. Your primary care physician will have a copay. There will be a higher copay if you see a specialist. There will be a copay if you have transportation by ambulance. You will have a copay for probably 5 days. If you are admitted to the hospital and stay those 5 days, you will be paying a copay for each of those 5 days. Typically, after 5 days, then the plan will take over. So because there are copays for most all services with a Part C Advantage plan, Medicare sets a limit on what you can be charged each year for maximum they call it maximum out-of-pocket cost, or MOOP, M-O-O-P. So that is set by Medicare. And right now for 2021, Medicare says that you will not have to pay more than $7,550 per year in network for your copays and deductibles that you may have to pay as part of your Part C Advantage plan. Then another part of that is that because it includes drug coverage, we want to be sure that your medications are on that specific plan's formulary, because each plan comes up with their own formulary based on Medicare guidelines. So you certainly want to be advised of a plan that includes your medications. You certainly also want to be advised of a plan that includes your specific doctor. If you have someone that you want to be sure to be able to continue under his or her care, or specialists as well. So those are two important considerations whenever we're looking for Part C Advantage plans for someone based on their individual needs. So as I said, you need to seek help, go through your primary care physician in order to have any services approved. But sometimes doctors are not free to say, yes, you can go ahead and have that service performed. And sometimes they actually have to seek first approval from the plan itself. So these plans sometimes can be limiting, and many people feel comfortable with these plans, especially when they have established relationship with a group of doctors and they don't have plans for the future for traveling. So again, as in all aspects of Medicare, we want to find out what your specific needs and plans are so that we can show you all your various options. All right, so then we're going to look at Medicare supplements, also known as Medigap. Look at them in a little bit more detail. Now, in this case, Medicare is going to be your primary insurer. The supplement company will be your secondary insurer. And all those companies that I mentioned who offer Medicare Part C plans also offer supplement plans. All of the ones I offered, that is, except Kaiser. Kaiser does not offer Medicare supplements. So, but they're completely different things. A Medicare supplement with United Healthcare is completely different from a Part C Advantage plan with United Healthcare. So with a Medicare supplement, there are specific plans that Medicare has approved. And you can see the numbers of these plans here, the letters of these plans. All states do not offer all plans. This is determined by each state's Department of Insurance. So you may not be able to buy a specific plan in your state. I can say that the most popular plan right now is the G plan, and it is available in most states that I work with. It is available in Colorado. So you see right above those letters of the alphabet, the word standardized plans. So standardized means that a G plan with Humana is exactly the same benefits as a G plan with Cigna, the same with Aetna, with Bankers Fidelity. So standardized means a G plan is a G plan is a G plan. So then what does it matter which company you go with if the plans are all exactly the same? Bottom line, it comes down to, most importantly, cost. You don't want to be paying more than you have to for your plan, especially since the benefits are exactly the same. And that's where we can come into play and help you. So some aspects of a Medicare supplement are, there are no networks. This is very different from Part C Advantage plans. This means that you can go to any provider, doctor, or hospital that you choose in the United States without a referral, without permission from your primary care physician. So that opens up possibilities a lot more than before. So let's just talk about a scenario and thinking about how Part C Advantage plans work with that network. Let's say someone is having a lot of trouble with one of their knees and they feel like they need to see an orthopedic doctor. Someone has a Medicare Part C Advantage plan, they're going to check in with their primary care physician. That primary care doctor may say, well, come in, let me take a look at you first. We'll decide if it's appropriate for you to go to an orthopedic doctor. You have to follow that process. Then your primary care doctor may or may not approve you seeing an orthopedic doctor. Let's say in that same scenario, you're having pain and you feel like definitely you need to have that knee looked at. Your best friend has an orthopedic doctor that he or she just loves, and they highly recommend that doctor. In the case of a Part C Advantage plan, you cannot call that doctor yourself. Again, you have to go to your designated primary care physician and find out, is this doctor that you would like to see in their network? If he is not, and you still want to see that doctor, he or she, you would have to bear the cost of that out of your own pocket. So in the case of a Medicare supplement, then this opens up possibilities. You can go to take the advice of your good friend, call that orthopedic doctor. If that doctor is accepting new Medicare patients, you can go see that see that orthopedic doctor on your own. So without any referrals or issues at all. So it makes it nice. Let's take that even a little bit further. In another brief example, let's say something's going on and your doctor can't figure it out on your Part C Advantage plans. He or she has sent you to specialists to see what's going on, still can't be figured out. And you're just tired of all of this. You decide, hey, I just want to go to Mayo Clinic. Bottom line, I want to know what's going on. If you're on a Part C Advantage plan, you cannot do that. You would have to bear the cost of going to Mayo Clinic on your own. So that's another bit of a limitation involved with the Part C Advantage plan. If you have a Medicare supplement, then in that same scenario, you want to go to Mayo Clinic, you make the arrangements, you go to Mayo Clinic, and Medicare is going to pay for that. You would have to pay for the trip itself. If if Mayo Clinic is not nearby, you'd have to pay for hotel or whatever. But for the care itself, Medicare is going to cover that for you if you have a Medicare supplement with original Medicare.
Yeah,
All right.
what percentage, what percentage in Colorado, when you guess, you talk to a lot of people, what percentage do you think go with Part C or Medicare Advantage versus going with the supplement?
I can tell you hands down that a supplement is the most popular way to go. Most of the time, people like the fact that it offers them more freedom of choice. It offers them the opportunities to basically have more of a say in their own health care and take more responsibility for that, rather than kind of turning that over to someone else to handle. There are those people who have confidence in their doctors, but really and truly, the answer to your question is, I'm going to say 95% will go with, yes, absolutely. Almost everyone goes with a Medicare supplement, staying on original Medicare.
Yeah, so pretty narrow, kind of number of people would it make sense for the Medicare Advantage, and this is significant too, because I'm sure for all of you, depending on how old you are, if you are what is it, about 64, you start getting inundated with stuff in the mail, right, from all these different insurance companies, and it can be confusing. I think that's why we have so many people attending today, because it can be a very confusing topic.
Right, and since you asked this question, Josh, it is important to note that when, like you just said, when you're getting close to Medicare age, you are going to be inundated. Let's say that you work for a large employer and the HR department may call you in and say, hey, we've got blah, blah, blah health insurance. Again, it could be Cigna, Aetna, any of them. Let's say it's Cigna. Then they're going to say, okay, you're getting ready to start Medicare. You're turning 65 in March. Let's go ahead and get you enrolled in the Medicare plan through Cigna, through our company. Well, that plan, I have never come across an HR department with a large company that tells you you can join a Medicare Part C Advantage plan, or you have the option of a Medicare supplement. They are going to direct you into a Medicare Part C plan with Cigna. Yeah. So it's extremely important, as you just said, Josh, to when you are approaching Medicare age, to be sure and get all of your options to find out what everything is available to you. And so that you don't make some mistakes, because let's say that while you were still employed, you went ahead and signed up for Medicare through your employer, and you took that Part C Advantage plan. Then now you're 68 years old, you're going to retire, and you're thinking, I think I'd rather have a supplement because it affords more freedom. We might want to travel more. Well, it's possible that you can change during that annual enrollment period time where you can drop your supplement, your Part C Advantage plan and join a supplement, but then you're going to have to answer health questions. So if your health is such that supplement companies are not going to want to accept you, then you're going to have to stay with a Part C Advantage plan. It may not be with the plan that you enrolled with originally, but you can change to a different Medicare Part C Advantage plan because, as we said earlier, they will always accept you. But you may not be able to make that jump over to a supplement because you did not get all the information from the get-go and knew that a supplement was available to you then. And that's why it's so critical at this time frame when people are getting close to going on Medicare that they truly get all of the options that are available to them and not just listen to, and this is by no means speaking down about your employer or their HR department, but this is what they're trained to do. And this is the options that maybe this is all that they're aware of. So they're going to direct you into that Advantage plan, but you need to take that responsibility for yourself. This is a big step going on Medicare and find out what all of your options are. So,
Thank you.
all right. Having said that, let's move forward talking more about the different aspects of a Medicare supplement. So again, we talked about that there's no referrals required to see doctors, specialists, or anyone. You don't have to have approval for any kind of services. It does come with a monthly premium. So again, a reminder, you're already paying your Part B monthly premium, $148.50 at least. Then an additional premium is going to be added on. That premium will be determined by your zip code. As different parts of the country are more expensive places to live, the same with Medicare. Some different parts of the country, your Medicare is going to cost more. That's going to be determined again by your zip code and by your age. And we have programs that we can put in that information. It's going to pull up all the supplement plans that are available for you in your area. Now, with a Medicare supplement, let's say you choose a G plan, which I said is the most popular plan at this time. A G plan does not have any copays. So you pay your monthly premium with a G plan. The only thing that you're going to pay is that Part B annual deductible, which is $203. You're already paying your Part B monthly premium. But when you have healthcare services with a G plan, you have to get that $203 annual deductible out of the way. Beyond that, Medicare and your supplement takes care of everything else. So why do we say here that this is, with a supplement, you have the ability to plan your annual healthcare budget? It's because, let's say your monthly premium on your supplement is $125. That is going to be times 12. And that's what's going to cost you, whether you, now we're not thinking about aside for your prescription medications or the fact that you're paying for your Medicare Part B annually, but we're just talking about your monthly premium for your supplement. Times 12 is going to be what it's going to cost you annually for taking care of yourself. Whether you see the doctor once or twice a year, whether something happens that comes along kind of catastrophic, like a big, huge accident or a major diagnosis, you're going to be paying the same amount. That monthly premium will remain the same. That I can't say it remains the same. I take that back. As in anything in the United States, things increase and you likely will receive an annual increase in your monthly premium beginning each anniversary of your enrollment into that plan. The average increase is about 6%. Occasionally, there can be a higher jump. Occasionally, there is a lower jump. or a lower, a drop. So, but with that, the fact that you have a monthly premium, no copays, you can plan what your healthcare costs are going to be. That is very comforting and gives a great deal of security to many people because we never know what's around the corner for us, right? So another part of your Medicare supplement, if you purchase that, is that you must purchase a standalone prescription drug plan. There is no coverage included in a Medicare supplement for your prescription drugs, as there was with the Part C Advantage plan. So you must purchase a separate standalone prescription drug plan. Which plan this is, how much it's going to cost, depends on where you live and depends on the medications that you take. So we'll talk a little bit more about this as the presentation unfolds. So there is seamless claims processing. What does this mean? All right, let's look at a scenario. You go to your doctor, you have some healthcare services performed, your doctor's billing department codes everything appropriately for Medicare. They send the bill to Medicare. Medicare reviews it, sees that everything is appropriate. They approve it. They pay their portion, which is approximately 80%. Then Medicare will send that on to your supplement provider, and they will see that Medicare approved what went on. They paid their portion. So your supplement provider is going to go ahead and pay the remainder. Then a few weeks down the road, you're going to get what looks like a bill from Medicare, but it's actually an explanation of benefits, an EOB. And in that EOB, it will state the date that you went to your doctor, the services that were performed, the cost that your doctor charged, or the price that your doctor charged for those services, the amount that Medicare paid, the amount that your supplement paid, and typically at the bottom, it is zeroed out as to what is due from you. So it's very simple, easy. That's another thing that people like so much, is that supplements are just kind of easier and straightforward as far as dealing with them. All right, so let's talk a little bit about Part D prescription drug plans. So once you enroll in Medicare Parts A and B, you really do have to have a prescription drug plan. Why? Because Medicare will assess a 1% per month penalty upon you for the time that you do not have one. Now, if you never buy a prescription drug plan, you're never going to have to pay that. But I have clients who, when they start on Medicare, they're not taking any medications. They say, so I don't need a prescription drug plan, right? And I say, wrong. You do need to go ahead and enroll in a Part D prescription drug plan. We'll put you on the lowest price monthly premium plan because you don't take any medications. This is to avoid that 1% penalty. Down the road in 5 years, if somebody thought they were going to be okay, they didn't have a prescription drug plan, no medications, something weird came along, catastrophic. So now they're taking 5 or 6 medications, and some of them are high priced. Then they want to sign up for a prescription drug plan. They're going to have 5 years worth or 60 months of a 1% penalty on top of the monthly premium of that plan.
Ouch.
So yes, so you for sure always want to have prescription drug coverage in place. There are a few situations where you don't need it. If you're a veteran and you're willing to get your medications through VA, Medicare is okay with that. So you have to have some form of creditable coverage that Medicare approves, or you have to purchase a prescription drug plan when you start in with Medicare. So again, there are 2 ways to purchase a prescription drug plan or have that prescription drug plan coverage. One is through your Part C Advantage plan, in which it is included in that plan. The other way is through purchasing a standalone prescription drug plan. When you have maintained your original Medicare, you've added on a Medicare supplement. You would then add on a standalone prescription drug plan. Okay, so another aspect of Part D prescription drug plans is the coverage gap or the donut hole. And for most people, this really does not come into play. This happens for those people who have a health condition that requires them to take medications that have a high retail cost. So in that case, depending, we're certainly going to try to figure out the most cost-effective plan. But sometimes when someone takes those higher cost medications, there's nothing that we can do about them being going into the donut hole for part of the year. A donut hole or the coverage gap applies January through December. Some people might fall into that hole in March. Some may not fall into the hole until October. Just depends on the cost of your medications. So again, remember that it doesn't apply to most people. And again, it's something to be addressed on an individual basis. How are we doing for time, Josh?
I think we are, where are we, Jeremy?
We are at about 50 minutes. So a few more minutes for you, Dannette, if that works.
Okay, and we're just about wrapped this whole thing up. So
Perfect. Yeah, I
Perfect.
had some questions. So for those of you who are still on, of course, and we will have a recording of this, but yeah, definitely hang around for the end here and we'll answer any questions that haven't been hit so far.
okay, very good. All right, so the next thing that we want to make you aware of is that not all health-related expenses are covered by Medicare. So you want to be aware of those that are and those that are not. And that is certainly by educating yourself. But this is an example of the things that are not covered by Medicare. Dental, vision, hearing benefits. And as I said earlier, some of these may be covered at a basic level on a Part C Advantage plan. With supplements, there is no dental or vision coverage. There is some basic, like if you have cataract surgery, Medicare is going to pay for that, even though you have a supplement. So no worries with that, but just standard, regular dental visits, vision visits, Medicare does not pay. Short-term, long-term care, Medicare does not have coverage for. Life insurance and final expense insurance. So I certainly advise you to check in with your consultants at Keystone, and they can point you in a direction to speak with some experts in these fields. So let's move on to, in fact, I want to remind you that Evershare Insurance, all of our consultations are free of charge for you. It's a service that we provide. It's very important to us that we educate you fully about your options with Medicare. So how do we get paid? We get paid by the carriers. When you enroll into a supplement, when you enroll into a prescription drug plan, if you choose to enroll into a Part C Advantage plan, we get paid by the carrier that you settle on, and that's how we're paid for our services. So if you need to contact us after you're enrolled and you have questions that come up or maybe a little issue or this or that, you're free to consult with us. We're your backup person. We're there for you. So this next little statement is really, really important. I want you to pay attention to it. The fact that we're brokers. That means we're licensed by multiple insurance carriers. We don't have an agenda with just one company in which we're going to really try to talk you into enrolling with that company. In other words, we're not captive agents. So we are going to look out for your best interest. We don't have an agenda other than to educate you and help you come to a conclusion about plans and that are going to be best for you in your future. So that's one really important aspect of Evershare Insurance. Here's where you can contact me, and you can always contact me also by checking in with anybody at Keystone. They'll be able to refer you over and get you over to me. Here's my contact information as well. And there you are, all the people at Keystone Insurance. All right, we've gotten to the portion that is questions and answers. So Jeremy, are there any questions that we might address at this time?
Yeah, and one thing I'll throw in too before we get in there too, I did want to touch on that last point is that with Eversure, we've worked with them for a long time actually, and the reason why is because they've just done such a great job serving our clients without an agenda. So I can attest to that we've had dozens of clients that have worked with them. And in a lot of cases, our client will say, yeah, I mean, they told us we should go with our retiree medical coverage, which means they didn't get paid anything, in other words. So Dannette's visited with a lot of folks over the years where, she's just trying to do the right thing. And ultimately, when you're running a business, what goes around comes around, and ultimately she's adding a lot of value. So I definitely recommend that you take advantage, or, if you've got a parent or somebody else who's Medicare eligible or planning for that, definitely recommend that you take advantage of that free consultation.
Absolutely. Thank you. Thank you very much.
Sure.
Yes, fantastic, Dannette. Thank you very much. I know I learned quite a few things actually just listening through that, and I consider myself fairly knowledgeable of Medicaid. So there you go. So I learned quite a bit, but we do have a couple questions here. And the first one is, and this one might be kind of more specific. So if it's specific, we can do that one. But
Absolutely.
Can you talk a little bit about Medicare and say Colorado PERA or PERA and kind of how they mix together? If that's a short conversation, I don't know.
That is not a short conversation.
Okay.
So that is something that definitely, as you said, would be something that we would want to consult with on an individual basis.
Yeah.
Okay.
And that's a common question. Yeah, that we, Jeremy and I get that question a lot as far as kind of employer coverage and how that relates to Medicare and the sign up process and all of that. So yeah,
Right.
I can tell you that's very knowledgeable in that.
Yeah, with any aspects of Medicare, as I said in the beginning, there's so many moving parts. So much it depends on what goes on with you individually. So an individual consultation would be the thing that would be most beneficial.
Okay, very good. Next question is there an advantage to signing up for Medicare in that 3-month window before or after or anytime during that 7-month initial window?
Well, if you have consulted with someone who is knowledgeable, you've gathered all your information, you have made the decision that when you're turning 65, you want to enroll in Medicare, then you can start that process 90 days out. So let's say someone is turning 65 in March, they can start in December, start the process. That means that they would contact Social Security, go into a local office, or they may, I don't know if those are even open these days for individual appointments.
Not yet.
But not yet. Okay,
No.
then you go online to ssa.gov, click on the button to enroll into Medicare A and B, make it effective for March 1st. If your birthday is March 20th, your Medicare benefits will begin on the first day of March. If your birthday is February 3rd, your benefits will begin on February 1st. So it's the first of the month of your birth. So you can begin the process 3 months prior to. You cannot actually start Medicare benefits until you're 65. So, but you can begin the process 30 days or 90 days prior to, and then you can wrap it up within, if you don't do it that month, you can wrap it up within 90 days afterwards.
Fantastic. All right. And then how far in advance of Medicare eligibility should one contact you to kind of determine this level of coverage?
It depends on the individual person. Some people I talk to a year ahead because they're one of those people who just kind of like to have it in their heads. They kind of like to have a pathway. They know where that pathway is going to take them. They want to know the individual choices that they have to make, the decisions that are down the road for them, that they like to have kind of a big picture of things. There are other people who feel like they kind of know a little bit about what's going on. They're not as concerned as those people who like to have a big picture thing. And so they can contact me later. It's not beneficial to wait until the week before because, well, let me back that up. You do need to have time to get Medicare Parts A and B in place before you want to start Medicare. Social Security can be expeditious about that, but they can also be not expeditious. So they're not real consistent. I can't tell you that they will have it completed within a 2-week time frame because they may or they may not. So I would encourage you, once you have made a decision that you know when you want to start Medicare, start that enrollment with A and B through Social Security 3 months ahead of time. It does not hurt. You can consult with me at that very same time. I'm going to advise you. If you tell me that you're ready to start Medicare in 3 months, I'm going to say, please go to Social Security, get that ball started, and we can talk about your various options. I'm willing to speak with anybody pretty much anytime that they want to learn about it.
Perfect. All right. And then we have another question. Lately, I've seen where Part C and several supplements are going away and need to change to another plan. Can you explain what is best?
Part C, there are always Part C Advantage plans and with various companies. So I haven't heard anything about Part C Advantage plans going away. It may be that a specific company might, they might redo their plan, but Part C Advantage plans typically are here. The thing that I think you may be speaking of is with supplements, the F as in Frank plan, we can no longer write for someone who turned 65 as of January 2020. So if someone turned 65 3 years ago, but they didn't start Medicare because they're now retiring from their group plan, I could actually enroll them into a plan F as in Frank plan. I would not encourage it. I would rather encourage them to go to a G plan, as we spoke about earlier. But the F plan is one that is no longer available to those who are turning 65 as of January 2020.
Okay, absolutely. Yeah, and we've heard of some of those changing over the years as, you know, specific supplements go. That also kind of sounds like if there's, you know, that might be kind of a more one-on-one question where,
Absolutely.
hey, I'm afraid that my supplement might be going away. What works best for me, to just kind of reach out to you at that point?
Absolutely, absolutely.
Okay.
And it always is a good thing to check in because we all have different situations going on.
Okay, perfect. And then our last question of the day is from Jimmy, saying that my spouse will reach Medicare age 1 year ahead of me and is currently on my employer plan. What advice do you have generally for a spouse to evaluate the jump to Medicare or staying on the employer's plan?
Okay, that's something that we run across quite often. And that is one of the reasons for an employee to stay on their employer plan, because their spouse is covered and will not be eligible for an additional year. So in that case, they have two options. They can continue on their employer plan. They can drop off and put themselves on Medicare, and then they can go online and look for healthcare on the health network for their spouse. And again, it's going to come down to pretty much cost. So I can advise them with maybe specific places to look for healthcare outside of Medicare for that spouse, should the employee decide to drop off. But that is one of the reasons, very typically, that an employee who is ready to go on Medicare will choose to stay on his employer plan longer until his spouse is eligible for Medicare as well.
Perfect. And then
Again,
really,
like I said, sorry to interrupt, we are going to lay it out apples to apples and decide which is most cost effective.
absolutely. Well, Dannette, that wraps it up for questions right now. Everybody that is typing in here has also said thank you very much for such an excellent presentation.
Good.
That was great.
Yeah. Thank you, Dannette. And a couple of things at the end I wanted to touch on. One of those is that Dannette and I actually had a chance to visit on the Wiser Financial Advisor podcast. So for those of you who have not been listening to this show, you should. It's a good show. But it's produced weekly, comes out Tuesday mornings. If you go to wiserfinancialadvisor.com or go to the Keystone's page, keystonefinancial.com, and click on podcasts, you'll see that episode here a couple of weeks ago. So you'll get a little bit more of a sense of Dannette, her background, and a little bit more about Medicare as well. So that's an opportunity. Also, take advantage of the 30-minute consultation, which Jeremy posted there in the chat feed. That's great. And then the other thing, of course, is that we want to be a great resource for all of you, of course, and anybody else that you know. Part of the reason why we do this, of course, is that our existing clients, would find this useful, certainly a value add that we want to continue to produce. But also, we know that there are a lot of you, and I see a lot of you in there and attendees. Maybe you're not clients yet. So we know you're coming eventually, but certainly all of you want to definitely get your feedback on how helpful this was. If there were other topics that you'd like to see us do in the future, either on the podcast or through the webinar format, we want to make sure that, especially in today's world where we can't get together physically, like maybe we would want to in groups, we definitely want to make sure that our digital format here is useful. So love the feedback and certainly appreciate all of your support. Anything else, either Dannette or Jeremy?
I'm good. I appreciate the opportunity. Thanks so much. And I hope to talk to some people down the road.
Yeah,
Absolutely.
great talk today.
Yep. And if anybody didn't get Dannette's contact information, we did put it out there. It was on the slides. We can absolutely, we can get it to you. Just contact us and we'll get the contact information out to you. Absolutely.
Great. All right. Thanks, everyone. Have a great week. And thanks, Dannette.
Thank
Absolutely.
you.
Thank you, Dannette.
Bye-bye.
Take care.